Today we are going to talk about porcine reproductive and respiratory syndrome, or PRRS, one of the most economically important diseases affecting swine worldwide. PRRS is caused by the PRRS virus, an enveloped, positive sense RNA virus in the family Artroviridae. The virus has an unusually high mutation rate, which is one reason outbreaks continue to occur even in vaccinated herds. PRRS primarily targets macrophages, especially pulmonary alveolar macrophages, the cells responsible for engulfing pathogens and coordinating the pig's early immune response. After entering through the respiratory tract or occasionally by semen, contaminated needles, or infected replacement animals, the virus binds to receptors such as CD163 on macrophages, enters the cells, and uses the host cell machinery to replicate. As infected macrophages die, the pig's ability to clear bacteria and viruses is significantly reduced. The virus then spreads through the bloodstream, producing viremia that commonly lasts 1 to 4 weeks, although some pigs remain infected longer. Because the immune system is weakened, secondary bacterial pneumonia caused by organisms such as Streptococcus suis, Glaesserella parasuis, or Pasteurella multocida commonly follows, often causing more severe disease than PRRS alone. The disease looks different depending on the age and production stage of the pig. In breeding herds, pregnant sows infected during late gestation frequently experience abortions, premature farrowing, stillbirths, mummified fetuses, weak-born piglets, and increased pre-weaning mortality. Boars may temporarily have reduced fertility because the virus can be shed in semen. In nursery and grow-finished pigs, PRRS usually causes fever, lethargy, decreased feed intake, coughing, labored breathing, poor growth rates, and increased variation in body size within the same group. Outbreaks are often most noticeable during colder months when ventilation is reduced and respiratory pathogens spread more easily, although PRRS can occur at any time of year. One of the key features that helps distinguish PRRS from several other reproductive and respiratory diseases is that it commonly produces reproductive failure in breeding animals while simultaneously causing chronic respiratory disease in young pigs. Unlike swine influenza, which usually spreads explosively with a high fever and rapid recovery in most pigs, PRRS often results in prolonged production losses because infected macrophages impair the immune response for weeks. Compared with pseudorabies, PRRS generally does not produce the severe neurologic disease seen in young piglets. And unlike African swine fever or classical swine fever, PRRS usually does not cause the widespread hemorrhages, cyanosis, or extremely high mortality that characterize those foreign animal diseases. Diagnosis begins with herd history and clinical signs but is confirmed with laboratory testing. Reverse transcription PCR, or RT-PCR, is the preferred test during acute infection because it detects viral RNA in blood, oral fluids, processing fluids, lung tissue, or other samples. ELISA testing detects antibodies and is useful for monitoring herd exposure but cannot distinguish vaccination from natural infection. At necropsy, the lungs are commonly mottled, fail to collapse normally, and show tan to gray areas of interstitial pneumonia. Microscopically, pathologists often observe thickened alveolar septa with infiltration by macrophages and lymphocytes. There is no antiviral medication that eliminates PRRS virus. Treatment focuses on supportive care and controlling secondary bacterial infections. Broad-spectrum antimicrobials such as ceftiofur, fluorphenicol, or tulathromycin are often administered when bacterial pneumonia is suspected. These drugs work by inhibiting bacterial protein synthesis or cell wall formation, reducing bacterial replication while the pig's immune system recovers. Nonsteroidal anti-inflammatory drugs, including flunixin, megalamine, or meloxicam, may also be used to decrease prostaglandin production by inhibiting cyclooxygenase enzymes, helping reduce fever, inflammation, and discomfort. Good ventilation, minimizing stress, maintaining hydration, and optimizing nutrition are equally important parts of treatment. Preventing PRRS requires strong biosecurity because infected pigs may continue shedding virus after clinical signs improve. Introducing PRRS-negative replacement animals, quarantining new arrivals, controlling animal movement, cleaning and disinfecting equipment, using filtered air in high-value breeding herds, preventing contaminated needle use between pigs, and maintaining strict truck and visitor biosecurity all reduce transmission. Modified live and killed vaccines can decrease clinical disease and improve herd stability, although they do not always prevent infection because the virus changes genetically so rapidly. Successful control programs focus on maintaining herd immunity while preventing the introduction of new viral strains. Feel free to send us a message via DM at @doggersgame or by email at dogtoursgame@gmail.com with topics you want us to cover next or to donate to our game and video development.